For the first time in more than 15 months, thousands of fans packed the iconic Madison Square Garden Arena in New York City for a rock concert at full capacity. But before anyone could get in to see the Foo Fighters, they were asked to show proof of vaccination. Overall, an encouraging sign in a city that was once the epicenter of the outbreak. But as more Americans celebrate reopenings, the highly contagious Delta variant continues to spread. The former FDA commissioner warns COVID variants and stalled vaccinations could fuel a fall surge, particularly among young children.
I think the reality is that kids are becoming more likely to be vectors of these new variants. I think the old assumptions about children and children driving community spread were based on the original strain of this virus. And with these new, more contagious variants, I think we're going to see that children in schools do become more of a focal point of spread.
With us again tonight, Dr. Kavita Patel, clinical physician and former senior policy aide during the Obama administration. She's also among our public health experts and a non-resident fellow at Brookings. So good to see you. I mean, it's scary stuff when you hear them talking about a spread among kids. How do we get younger people vaccinated, and what's the real threat if we don't?
Yeah, Chris, so it's interesting. The CDC just conducted several studies showing that about 25% of young adults aged 18 to 39 said that they would definitely or probably not get vaccinated, just full stop. And so right there, we're already operating with 1 in 4 young adults. And then when we talk about children, 12 to 17, and then hopefully we'll have a vaccine under 12 available soon, Chris, we start to hear more concerns. And so this, as Dr. Gottlieb mentioned, offers an opportunity. The virus doesn't know any boundaries, as you know, and as more older adults are vaccinated, it's going to go where it can to replicate, and that means that younger children will be more vulnerable. By the way, it's what we're seeing in Israel, where they just recently were able to vaccinate younger adolescents, but they've had several outbreaks, and that has primarily been driven by children in a high vaccinated country.
Yeah, the way the World Health Organization put it, pretty striking. They say the Delta variant is the fastest and fittest COVID strain yet. So, I mean, there's a lot of folks out there, you know, they see MSG full of folks, they're getting out, people aren't wearing masks. So what should be their level of concern? What needs to be all of our level of concern about this?
Yeah, Chris, if you are not vaccinated, I really do urge you to think about when you will get infected, not if you will get infected. And that's because, as you mentioned, the Delta variant, which is our variant of now. We didn't have a Delta variant months ago in the United States. Now it will likely be the dominant strain, 60% more infectious than the Alpha variant, which, Chris, as a reminder, was 40% more infectious than what was really whipping us around the country last year. So that's what I say to people, that this is really a simple mathematical issue. Fewer people to infect. Therefore, if you're unvaccinated, you will be one of them. We need to break these chains of transmission. And Chris, we have parts of the country, you've covered it, where we still have 35 to 40% only vaccinated, leaving the majority of people unvaccinated.
Yeah, and I've been to any number of those places, and you don't necessarily see a lot of people wearing masks either. Right. And then you have the big picture about the international concern. The Biden administration just outlined which countries are going to receive that 55 million doses of vaccine. You know, they want to fulfill their pledge to share 80 million globally by the end of June. But the press secretary, Jen Psaki, was pressed on the pace of distribution, and I want to play what she said.
The president promised to distribute those 80 million by the end of the month, but he's obviously falling short of that goal. Why is it taking so long?
Well, first, let me say we're committed to allocating those doses. We've done exactly that. What we found to be the biggest challenge is not actually the supply. We have plenty of doses to share with the world, but this is a Herculean logistical challenge. We will continue to announce as they land on the ground and as they are being shipped, and we're looking forward to doing that as quickly as possible.
In our final 30 seconds, Dr. Patel, can you help us understand how complicated it is to distribute vaccines globally?
Yeah, everything from having the right supplies on the ground to the right personnel on the ground and a strategy to get people vaccinated. As we know, you don't just dump a plane full of vaccines and then just hope intentionally that it gets into people's arms. particularly a 2-dose vaccine. So it is logistically complicated. Having said that, it's an incredible priority. It has to be done. 80 million is just a drop in the bucket, fighting a wildfire with literally a drop in the bucket. We've got billions more to vaccinate.